Skin lesions. So firstly, we are looking at the alopecia. Alopecia is nothing but it's the absence of hair, and this is from a normally hairy area. And next is aphtha. This refers to a small ulcer, and this is of the mucosa. Now moving ahead with the atrophy. What is atrophy? Atrophy is nothing but it is a loss of tissue, and this is basically from one or more epidermis, dermis, or the subcutaneous tissue. Then there is something known as the burrow. In terms of the burrow, it is basically a small tunnel, and it is present in the skin that houses a parasite such as the scabies acarus. Next we are looking at the callus. Callus is nothing but a localized hyperplasia, and this is basically of the stratum corneum. Now moving ahead, we are looking at the cellulitis. In terms of cellulitis, it is basically an inflammation of the cellular tissue, and particularly it is a purulent inflammation, and it is of the deep dermis, and also the subcutaneous tissue. Now looking at what is the comedo. Comedo refers to a plug of keratin. It is nothing but a plug of keratin as well as the sebum, and it is present in a dilated pilosebaceous orifice. Next, we are looking at crust. In case of crust, is nothing but also known as scabs. So crust or scabs, the crust, it consists of the dried serum as well as the exudates. Now looking at what are cysts. Cyst is nothing but any closed cavity, or you can also call it a closed sac. It can be normal as well as the abnormal, and it has a epithelial, it has a endothelial, or it can include the membranous lining, and it contains a fluid or a semi-solid material. Next we are looking at the ecchymosis. In case of the ecchymosis, it is nothing but a macular area, and it is of the hemorrhage, and this is greater than 1 centimeter. It is nothing but a bruise, and this is 1 centimeter in the diameter.